It's all yours.
Good morning, everyone. So good to be here. Thank you again for the opportunity to speak before you today about the Medicare open enrollment period and things that you can yourselves prepare for. My name is Michelle Thomas, and I serve as the program coordinator for VICAP, which is an acronym for the Virginia Insurance Counseling and Assistance Program. VICAP is part of a national network, the State Health Insurance and Assistance Program, that spans across the United States of America. So they have programs in every state, including the U.S. Virgin Islands, Puerto Rico, and of course, Washington, D.C. That's not out of state, not yet. I know the mayor is trying to make those changes, but in Virginia, the program is called VICAP. And so there's one in every jurisdiction across Northern Virginia. I'm blessed to be able to lead a team who provides counseling in this area, and our team consists of staff and also volunteers. So if anyone has any questions that are not answered today, you're more than welcome to reach out to our program. I did provide the contact information in the chat, but for those who are calling in by phone, thank you. Our hotline number is 703-228-1725, or you can email medicarehelp@arlingtonva.us. And again, for the Arlington County program, we serve Arlington County residents only. So with that, I'd like to share my screen and begin the presentation to talk to you about how to make the most out of Medicare and the Medicare open enrollment period. Here we are. Okay.
There we go.
Thank you. Welcome to today's program, Making the Most Out of Medicare. Our team, again, is staffed with county staff who work with the Arlington County Department of Human Services, specifically the Aging and Disability Services Division, and then a wonderful group of volunteers. And that's how the programs are organized and structured across all SHIP programs. We are federally trained and certified, so that means that each year in the spring, everyone who is signed up to be a counselor is required to complete a exam by the state and the feds, and we have to pass the exam with an 80% or higher to be able to counsel individuals who have questions about Medicare specifically within Arlington County. Since the height of COVID, our team works in a hybrid fashion, which means that we conduct counseling, information sessions, presentations, etc., in person or virtually by phone and or using a technology tool like Zoom or in Microsoft Teams. Our team does counsel individuals on all facets of Medicare, but then we also help individuals resolve Medicare claims or billing issues. We have and continue to assist individuals with applying for Medicare-related benefits, and then we do pride ourselves on connecting individuals to programs to help reduce their out-of-pocket Medicare costs. And I'll talk a little bit more about that a little bit later. In today's program, we're going to cover the Medicare Part D prescription drug benefit, what Part D covers. I definitely want to spotlight the enrollment periods, questions to consider asking when choosing a plan, where you, and of course, I'll weave in a little bit more about what's new for you to consider during the 2025 Medicare open enrollment period. But first, I want to offer some background information. This is, of course, is the new Medicare card. Medicare is available to individuals who are 65 years of age and older, who've paid at least 10 years of FICA taxes. And then, of course, we serve individuals that are under the age of 65 who have been deemed with a disability by the Social Security Administration. Medicare is also health insurance for individuals who have received a diagnosis of kidney disease or end-of-stage renal disease, and then Lou Gehrig's disease. Our policies, Medicare Plan Finder, and so much more comes from our friends at the federal level, our partners, CMS, also known as the Centers for Medicare and Medicaid Services. There are 4 parts of Medicare, Part A, B, C, and D. Part A is hospital insurance. B is medical. Part C, I like to call bundled insurance because it can include A, B, and then it may or may not have a prescription drug plan. It just all depends. And then there's the Part D for Medicare prescription drug coverage. So there are 2 ways that individuals are able to obtain their drug coverage: original Medicare or a Medicare Advantage plan. For individuals who are interested in obtaining a Medicare supplemental insurance, or what some call a Medigap policy, you're only able to do that if you have original Medicare. It is against the law for a broker to sell a Medigap policy to someone who has a Medicare Advantage plan. Under original Medicare, you normally need to have a Medigap policy and a Part D drug plan. Medigap covers all things that original Medicare may not. The premiums, of course, are different for each part of Medicare. It just all depends. We do use the Medicare Plan Finder on Medicare.gov to be able to yield some of that information, specifically around C and D. And then for premium information for Medigap policies, there is a Medigap rate finder offered by the Bureau of Insurance's the State Corporation Commission's Bureau of Insurance. Under original Medicare, typically there's no coverage for dental, hearing, and vision. However, I do like to share with people that there are alternative options to consider. When we get this question in our office, we do provide a few options to consider for dental providers and dental insurance. There are nonprofit organizations that can assist with getting hearing aids, and I know some of the clients we've worked with have also informed me that they've been successful in getting hearing aids from Costco. I have not, referred anyone over to Costco, but there have been a good amount of individuals who have raved about their Costco experience. And then vision options for folks who are interested or in need of that. We do have our partners within the Aging and Disability Resource Center, which is housed under the Area Agency on Aging, and they have case managers there that can assist with that. They can be reached by dialing 703-228-1700. Generally speaking, people with original Medicare do have more choice when choosing providers, especially in this area. Sometimes when we look at providers accepting insurance, we do know one of 2 things already, which is the providers in this area are more inclined to accept original Medicare. But then on the other side, I am learning that there are more doctors who are no longer accepting geriatric patients, which is causing its own issues because it's shrinking the pool of providers that are available for folks to make appointments. Generally speaking, there's no mandatory cap on out-of-pocket costs under original Medicare. And then if you consider a Medicare Advantage plan, sometimes the premiums are cheaper, but the co-pays and co-insurance can be higher. And again, looking at the Medicare Plan Finder is one way to be able to do that, and our team is also happy to help. There are some limitations on benefits, although they're advertised under Medicare Advantage plans for dental, hearing, and vision. And for those who are interested, that's something that we can help you walk through as well. Under Medicare Advantage, you must use the plans in network. If you go out of network under an MA plan, then that'll open up the opportunity for you to be billed at a much higher cost, which sometimes is just not feasible. Under Medicare Advantage plans, you may need to change plans if you move out of the plan service area. The plan service area is also considered to be the same as a person's zip code. There is a cap on out-of-pocket costs, and then you, of course, can switch to original Medicare, but it may present its own challenge. So let's talk about Medicare Part D's prescription drug benefit. Medicare Part D's prescription drug benefit is a part of Medicare that provides prescription drug coverage. It's through a list of contracts that are offered and that partner with the CMS or the Centers for Medicare and Medicaid Services. They are standalone plans. We do encourage people to make sure you're checking to see if you're doing this on your own, that the Medicare Advantage plan that you're considering contains the prescription drug benefit, because all of them do not. When you're choosing a Part D plan, it's important to understand, of course, what it covers, how much it costs, and then enrolling at the right time. So let's delve in a little bit more to see what Part D actually covers. So Medicare law requires plans to cover drugs that are FDA approved within the US, prescription drugs only, prescriptions that are medically necessary, biological drugs, insulin, and insulin syringes. And I'll talk a little bit more about insulin in just a few minutes. There are some drugs that are excluded from Medicare, which includes most over-the-counter drugs, prescriptions, vitamins, and minerals, drugs used to treat anorexia, weight loss, weight gain, or any absent certain medical condition, cosmetic purposes, hair growth, and then prescription drugs to treat erectile dysfunction. Let's talk about what Part D costs, and then, of course, how you could potentially lower or raise your costs. So within Medicare Part D, they have something called a monthly premium, which one may see within the Plan Finder. The monthly premiums vary, although the lowest cost that I've seen is $0 for 2025. People who have higher incomes, $100,000 or more, of course, pay more, something called IRMA. There is something called an annual deductible. That also varies by plan, but it does not toggle up to more than $545 in 2024, and I think it's $590 for 2025. There are also co-insurance and co-pays, which depend upon the plan. The drug costs could be affected by the drug's price tiers, which is something that my team and I look at. And then under the Inflation Reduction Act, which was passed and has been signed into law, there is now a $35 cap per month for insulin drugs. I did take a look in the Plan Finder the other day and saw that all of the insulin drugs are yielding that number, which is great because I know last year that wasn't the case. The Plan Finder wasn't updated, so I'm happy to see that for this year. Drugs in lower tiers are less expensive, and then every drug plan is also different. You could run into 3 types of coverage restrictions. It just all depends. So if you're needing a prior authorization, which is a pre-approval by the plan before it'll pay, it may, pose its own impact. Step therapy requires a trial use of a less expensive version of your first drug. And then, if there are quantity limits on the drugs that you need, that would, of course, lend for the opportunity for you to have to interface with your physician a little bit more. And I know sometimes that can happen for those who are taking or been prescribed narcotics, for example. I do want to talk about the Part D drug phases and how it affects costs. Um, Again, the yearly deductible, the initial coverage, the coverage gap, and the catastrophic coverage are all things that can affect your drug costs. If you have questions about that, of course, I'm happy to set up an appointment to be able to talk about that. One thing here I do want to point out is the coverage gap. The coverage gap, which some people call the donut hole, fancy term for it, is when a total covered drug cost paid by you and your plan reach a certain amount, then you pay 25% of the drug cost. And then the catastrophic coverage is also something to consider. So when total out-of-pocket costs reach $8,000, then your drugs are fully covered, which is something that's great to know. But in 2025, and this is part of the Inflation Reduction Act that was signed into law, the donut hole has been eliminated. So now Medicare beneficiaries have something great to look forward to. There is now a $2,000 cap on total out-of-pocket costs for prescriptions. So for those individuals who take prescriptions that are very expensive. I know sometimes we've helped individuals who have multiple chronic illnesses. So, cancer, diabetes, and so much more. The cancer drugs alone could potentially cost more than $2,000 a month, let alone a whole year. But through the IRA, which is the Inflation Reduction Act, there's now a cap on out-of-pocket drug costs, which is great. There are opportunities for individuals to be considered for programs to help lower their out-of-pocket costs. Extra Help is one of them. Extra Help, also known as the Part D Low Income Subsidy, is offered through Social Security Administration. And it's a federal program that helps to reduce the out-of-pocket costs for prescription drugs only. And it's available to individuals with limited income resources and assets. And our team can help individuals complete those applications online. Social Security will then make the determination of who's eligible and then follow up by postal mail. So a person, if someone is considering this program, or if they're, a caregiver, have a neighbor who this may be helpful for, if your income as an individual is less than $1,900, or if you're a couple and your income is less than $2,500, then you will be eligible. So the income and asset limits do apply. And then, of course, once we're completed this presentation, I'm happy to add the link into the chat for folks if they're wanting to know more. So you're automatically eligible for Extra Help if you're on SSI, Medicaid, or enrolled in a Medicaid savings program. There are other ways to be able to save on prescriptions, which is generic drugs. Talk to your doctor about that may or may not be applicable. Asking for samples, especially if the drugs that you're taking are really expensive. There are ways to appeal, and we do have some experienced counselors on our team that can help you with the appeal process. There are patient assistance programs, which are offered through the drug manufacturers. And I know we've been able to save individuals, tens of thousands of dollars by getting connected to PAP programs. Again, those programs, like Extra Help, are contingent upon a person's income, resources, and assets. So let's talk about enrollment periods. It's important to enroll on time. In order to enroll in a prescription drug plan, you have to have Medicare Part A and or B. Of course, live in this plan service area. If you're looking at the plan finder, it is the service area is equivalent to a person's zip code. And then the enrollment period is definitely something to consider. So I know when folks reach out to Social Security or Social Security reaches out to them, they may tell the beneficiary that Part D is optional, but I'm not quite sure that they explain it's optional, but if you don't enroll and you don't have creditable coverage, you are subjecting yourself to a potential penalty if there's ever a time when you are going to need Part D or want to enroll in a Medicare Advantage plan with prescription drug coverage. I know sometimes we get calls from individuals who are enrolled in a plan through their spouse or they have retiree insurance, et cetera, and that's fine. That would be considered creditable drug coverage. If you have any questions about that, please do let us know. The penalties for Medicare are generally for a lifetime, not a quarter, et cetera. So in order for people to avert some of the lifetime penalties that Medicare may impose, if you don't enroll on time, you would have to be eligible for something like Medicaid or one of the Medicare savings programs. The enrollment periods I wanted to highlight is the initial enrollment period, which is the 7-month period that people can enroll. It's 3 months before your birthday, your 65th birthday month, and then 3 months after. There are other times when people can enroll in plans, an SEP or special enrollment period, and there are so many caveats as to what qualifies a person to enroll in an SEP. These are just a few. So if your plan moves, it changes, terminates, then that would make you eligible. There are 5-star plans that can be considered that could trigger an SEP if you lose extra help, and then so much more. If you move, right? So we get calls from individuals who are moving their loved ones from one state to the other, Arizona to Virginia, New York to Virginia, California, the list goes on. People move their loved ones all the time. That then prompts what's called the special enrollment period for people to enroll in Medicare here in Virginia. And then, of course, there's the open enrollment period, which is coming up very soon. It starts October 15th and it ends December 7th. During that time, you can assess, join, switch, or change a plan. And anytime you enroll in a plan during the open enrollment period, your coverage will then begin on January 1st. As we look ahead, during the Medicare Advantage open enrollment period, which it kicks off next year in January, if you already have a Medicare Advantage plan and you want to switch, that's the time you would do it. So the late enrollment periods, they apply. Again, if you're enrolling late, Social Security Administration, for those who are turning 65, is supposed to initiate the communication, reaching out to the beneficiary to send them what's called a Welcome to Medicare packet. If you're turning 65 and it's 3 months before your 65th birthday and you have not received the Welcome to Medicare packet from SSA, please do be a little bit more assertive. Reach out to them by calling them. From what I understand, they are not taking walk-ins. They are taking appointments. So give them a call to initiate that conversation, because there is an applicable late enrollment that is assessed, if you don't enroll on time. I do want to offer some guidance on the questions that you can consider asking when you're choosing a plan. Does this plan cover all of my drugs? Sometimes individuals are excited about plans based on what they offer or what they say they're going to offer. But it's really important to make sure that the plan not only covers all of the prescriptions on your formulary, but that your doctor is also going to accept the new coverage if you decide to switch. Are there any restrictions on the new plan you're considering? That's something you can talk with your doctor about. Looking at the costs. Are there costs associated with the plan? Well, yes, maybe. It just all depends. That's something that our team can help with. Looking at programs that could help to reduce your out-of-pocket costs also helps because Medicare costs go up every year. And it's not just one part of Medicare, it's each part of Medicare increases its costs. Congress, of course, makes that determination, and then they send that information down the pike to our federal partners at CMS, who then, let us know what those costs are going to be for the next year. Are you a high income earner? Well, if you are, going back to the point I made earlier, then you would pay a little bit more for your health insurance. And then most importantly, are the pharmacies that you're looking at preferred or network? It matters. CVS may charge more than Walgreens. Safeway may not be a network. So you could get your prescription filled at CVS or somewhere else for $20. And if you look at the same drug at Costco, it may be $150. So please do consider that. Take a look at that, whether it's preferred or network, and the plan finder does offer that information. So how can you enroll in a plan? Well, of course, you can give us a call. We're happy to help. 703-228-1725. We also help to offer guidance. So for folks who are interested in doing it on their own, Medicare.gov has the Medicare Plan Finder to be able to do that. Going through the drug plan directly is an option. There are paper enrollment applications, and then calling 1-800-Medicare. 1-800-Medicare is available 24/7, 365 days a year. I do want to round out by talking about what's new in 2025 so that you can be aware. So under and through the Inflation Reduction Act, there is a $2,000 out-of-pocket limit for Part D prescription drugs. There is something new called a Medicare payment plan, which offers the option for beneficiaries to spread their costs over the entire year instead of having to pay larger costs at the beginning of the year. So going back to the example that I provided not too long ago, if you are an individual, your loved one, etc., is an individual who is taking a drug or a few prescription drugs that are very expensive through the Medicare payment plan, which of course is optional, and you have to call the plan to enroll. It gives you or the individual an option of spreading out their payments, so they're not paying so much at the beginning of the year. There is a limit on cost sharing for insulin. So all insulin drugs, and I mean all insulin drugs, are now $35 a month. And our team is doing a new diabetes prevention and management campaign. I thought I'd plug that here. So for individuals who are taking insulin and they're looking at plans that they want to enroll in, that's something that our team can help with as well. And then, now there's no cost sharing under the IRA for vaccines. And I know in the past, shingle shots have been really expensive. Now that all has been eliminated through the Inflation Reduction Act. The other thing I wanted to spotlight is that in 2025, the Part D prescription drug plans are continually dwindling. Last year in 2020, this year in 2024, because the plan finder can show you the projections for next year, right? But there were, I think, 20 prescription drug plans, but even that's dwindled because in years past, I think there were up to 34, and each year it keeps dwindling. So in 2025, the plan finder is showing that there are going to be 14 prescription plans available in Arlington County. 24% of individuals with a standalone Medicare prescription drug are eligible for extra help. That's something that our team can assist with. The plan finder indicated that the lowest monthly premium for a standalone PDP or prescription drug plan is $0. And then that toggles up to 112 depending on the plan. So although the amount of Part D prescription drug plans are continuing to decrease, the number of Medicare Advantage plans either remains the same or increases. So for 2025, the plan finder indicates that there are going to be 34 Medicare Advantage plans available to constituents in Arlington County. The lowest monthly premium for Medicare Advantage plans with prescription drugs is $0. And then that toggles up to $137 a month. Of course, again, depending on the plan that the person is considering. I do want to tease this out a little bit to talk about the Medicare prescription payment plan. So for clarity's sake, this Medicare prescription payment plan, again, is optional, but it's aimed towards beneficiaries who have a higher drug cost, especially when they have higher costs earlier in the year. The beneficiaries can start a payment plan at any time, but it's more advantageous to be able to do that earlier in the year. I do have the link here, and I can definitely share that with you. Unless you want to take a screenshot of this, that's okay. The Centers for Medicare and Medicaid Services has offered information about the Inflation Reduction Act and specifically the Medicare prescription payment plan if you're interested in learning more. And then to round it out, I did want to offer some takeaways and checklists. So it's really important for individuals to evaluate their coverage on an annual basis. Even if you're happy with the current plan, it does not hurt to consider reviewing other options. It also is really important to take a look at the plan information that's sent to your home. I know that there have been some issues with the Postal Service and US mail getting to individuals at times. So if you're in Medicare or you're a caregiver and you're taking care of someone who has Medicare, helping a neighbor, etc., if they have Medicare, they should receive their annual notice of change now. So what's today? Today is October 2nd. The annual notice of change or the ANOC should have been received by the beneficiary at the end of September, definitely within the next week or so. That document, although not a light read, is valuable because it sheds light on what's changed in your plan for the next year. And that could include costs, coverage, co-insurance, and things like that. Sometimes, it's a challenge to read just because it's such heavy information. So if you're not reading that document that the plan sends, you can either call the plan to find out what's changed specifically with that plan for next year, or give us a call and we can walk through it together. The enrollment periods are something that I highlighted because it's really important for people to enroll in Medicare at the right time. If they don't, there could be permanent financial penalties that apply. Researching options, of course, is always important to do because there are differences between original Medicare and Medicare Advantage plans. It's important to consider programs that reduce your out-of-pocket Medicare costs because Medicare, like other healthcare expenses, continues to climb. And that's, the cost for Medicare Part A, B, C, or D, and the increased cost for Medigap policies for those who are enrolled in one. And then finally, Arlington County VICAP is here to help. And then we can be reached at 703-228-1725. Here are some resources that I'd like to provide. Going to our website for Arlington County VICAP, the Centers for Medicare and Medicaid Services is also a great resource. And then the Medicare Plan Finder offers information on how to identify health and drug plans, including the plans that have the star ratings. So with that, I'm going to stop sharing my screen and we can open up the floor for questions.
All right. Our first question is there an agency like VICAP in Maryland, and what's it called? So we've got somebody who's a caregiver for a person over there and is having some issues.
Yes, thank you for your question. Yes, there is a SHIP program across the United States of America. So let me pull up I found it, State Health Insurance and Assistance Program. Contact your local SHIP. And I'm going to put this information in the chat for you to include their phone number. And get their phone number, 1-800-43-3425, 1-800-243-3425. And I also put the information in the chat.
Okay, the next one is somebody wanted some clarification. If they have a federal health benefit, are they correct in the understanding that they don't have to enroll in Part D?
If you have prescription drug coverage through your federal employee health benefit, then you have what's called creditable coverage. So if you already have creditable coverage, then you do not need to enroll in a separate Part D plan. And, we can definitely talk more about that offline if you have follow-up questions about your personal situation. That's a short answer.
You talked about the number of Part D plans decreasing. If somebody has a Part D plan and they're happy with it, they're going to just let it roll over to the next year. If that plan is going away, are they going to get notified about that in time to pick a new plan, or is it incumbent on each of us to go check and make sure?
Yes, I would say it's important to check just in case. The plan is supposed to send out information. And again, that information should have been shared by September 30th. If you have not received information from the plan by September 30th, maybe give it this week. But with the holidays coming up, Columbus Day, so many others, and the exacerbated postal service delivery issues across the country, give your plan a call or set up a meeting with us and we can walk through it with you. Even if you're happy with your current plan, sometimes the rate changes for the plans will increase. So we've had issues in the past where an ANOC may have been sent out, the person never received it, or didn't receive it in a timely fashion. They paid $20 for their monthly premium in 2022. They never bothered to change. Well, when January rolled around, and then they got the newer bill to say, okay, so now the cost for your monthly prescription drug is $55. They were alarmed and they gave us a call. We had to work with them to try to do damage control. But even if you're happy with what you have, it's really important to remain informed. so that you are knowledgeable about any potential changes coming down the pike for the next year. Open enrollment is the time to make that change. So if you call us in January when you were supposed to change between October 15th and December 7th, there isn't much that we can do at all, because now you've missed the enrollment period of when to do that.
Okay, next question is, what's the best way to decide the best Medicare Advantage program? Does VICAP help with that?
Yes, we do. And if they're in Arlington County, they can set up an appointment with us by calling 703-228-1725, and then we can take a look at the specifics within the plans that you're considering to make sure that the cost sharing makes sense, to make sure that the specialist, if you need to see specialist, makes sense. And then, of course, it covers all of your prescription drugs and so much more.
Okay, what is meant by people who are dually eligible?
Dual eligible means that an individual has Medicare and Medicaid insurance.
Okay. Some plans offer lower costs for prescription drugs by mail. Is this a good choice given issues with postal delivery, or is it better to find a local provider in a plan?
Yeah, if I were in that position, I would definitely put myself in a position of where I'm not so reliant on the postal mail just because they've had their own issues. A lot of people are taking routine prescription chronic diseases, which means that they're somewhat reliant on them. And I would hate for someone to be in a position of where they're not getting, and we've seen this in our program, individuals don't get their prescriptions on time because they're not coming through the US Postal Service and having to call their physician to see if they can make an exception and all of those things. So if you're able to find a local pharmacy that has your prescriptions, that's in network, if you want to rely on another service because maybe you're having a challenging time getting it, there are ways to do that. So Uber, sometimes CVS does deliver as well. It just all depends. Maybe consider exploring that. And then if you want to talk a little bit more about that, or want some guidance in trying to find pharmacies that deliver, that's something that I can help you with as well.
Okay. Medicare Part A and Part B are only going to cover people inside the US, right? If you're traveling overseas, you'd want to
Yeah.
get some kind of travel insurance.
Travel insurance or Medigap policies that can help to cover the gaps that Medicare does not cover, yes.
So Medigap policies will cover overseas travel?
Yes.
Okay. All right. Well, I don't see any additional questions. Does anybody else have anything?
Michelle, maybe one of the things, because I think that there's always, and maybe everybody on this call or this meeting knows this, but has there been any changes in terms of Medicare covering anything in terms of long-term care? So often we know that, what Medicare does cover, but is there still a widespread misbelief or under not knowing about the fact of what Medicare does not cover in terms of long-term care?
Mhm. Yeah, there's still, that's an advocacy area, I would say, for individuals to contact their congressional officials, because you're right, Medicare does not cover long-term care. And when counseling caregivers, that question comes up often. And the only opportunity of where individuals can get more financial support for long-term coverage is if they have a long-term care insurance policy. That's one way to be able to do it. Of course, enrolling early enough. My mom, who is well into her 80s now, was talking to me about a long-term care policy, she won't even, they won't even insure her because according to them, their language says she's too old and she's more of a liability at this point. So there are, and when it comes to insurance coverage and insurance brokers, they do look at a person's age and sometimes discriminate, or if they say, yes, you can get this, or yes, you can get that, of course, the amount is exacerbated, right? You may pay 3, 4, 5 times much more than if you were to have enrolled earlier. But long-term care insurance policies is one way to be able to do it. And then for those individuals whose income is limited, if they have Medicaid, based on their income, resources, and assets, Medicaid is one way to be able to cover that. But Medicare, unless it's hospitalization under Part A, which is, short term, there's no coverage for that. And also going back to the dental, vision, and hearing, right? So if you have original Medicare does not cover dental, vision, and hearing. There are some coverage options available that are limited through some Medicare Advantage plans. It just all depends, but that's something that our team can help you work through as well.
Well, thank you for mentioning that, having just had a root canal about a month and a half ago and having to pay $2,500 out of my pocket. I know exactly about the fact that Medicare does not cover any dental care. So is there any thought of changing that? I mean, my goodness, dental care and hearing and vision is so important as far as older adults.
It is, and I definitely encourage people to advocate through their congressional officials to help change that because Medicare is a federal program. There's so much that has to change at the federal level. So writing letters, calling your congressional offices is one way to be able to make that change. There are some slight changes that have come down the pike about Medicare and dental, but someone has to be, getting surgery. Like it really has to be a drastic change. And then, of course, not everyone's income meets the low income thresholds, and Medicaid's income thresholds are so low. I mean, they're lower, I think, than what they really need to be because it makes it almost impossible because then you have, individuals who are middle income because inflation is so high, it makes it a challenge. The ADRC, though, through the Arlington Area Agency on Aging, there's the Aging and Disability Resource Center in Arlington County for individuals who could use some supplemental support to be able to pay for additional costs for dental care, like you just mentioned, Cheryl, or getting a hearing aid or eye appointments. And they can be reached at 703-228-1700, and I'll put that information in the chat as well.
We have a comment here. We were talking about overseas coverage. They said United Healthcare used to offer a Medigap policy that covered overseas travel, but they don't anymore. So,
and all of those, and it's important if you are trying to keep a pulse on that. Let me see if I can quickly find it, but the Bureau of Insurance monitors all of the brokers, including United Healthcare. One of the things, though, I brought to the state director's attention is that unfortunately their website, maybe then I won't share it, their website isn't always kept up to date. They are relying on brokers and companies like United Healthcare and Aetna and others to send them information anytime it changes. And unfortunately, they don't always get all of the changes in real time, which then creates a lag of correct information that's then posted on their website. But the Bureau of Insurance, through the State Corporation Commission, does have an arm of where they monitor all insurance brokers. I can offer that site, though. That'll be helpful for those who are interested.
Okay, I'm not seeing any additional questions.
There we go.
So,
Current agents and agencies. It offers information about license renewals, whether there have been some issues with the brokers or insurance companies before, things that people should consider.
One other quick question that I could also ask is that, if somebody is concerned about, getting billed or whatever, you often hear about Medicare scams. If somebody has a concern about that or knows somebody who may be a victim in some way, or somebody's trying to, a scammer is trying to finagle some extra money through Medicare, does VICAP provide advice and counsel on what they need to know?
Absolutely. Thank you so much for bringing that up, Cheryl. VICAP does. We have a contract and work very closely with the Virginia's Senior Medicare Patrol.
Mhm.
And the vision and goal, the mission of the Senior Medicare Patrol, also known as SMP, is to provide information and education around Medicare fraud, waste, and abuse. And we do that through working in the community, facilitating different presentations. And then we've also just launched what's called a VICAP Training Academy, which is housed on our website. And you can interface with an interactive training that specifically talks about Medicare fraud, waste, and abuse. But give us a call if you have any issues related to that. We have had a couple of individuals reach out to us to say, my Medicare card was compromised, or I have been the victim of identity theft. That's been more on the rise, unfortunately.
Big
I've heard,
time.
yeah. And so, working with the Senior Medicare Patrol, the Federal Trade Commission, advising people to contact the police department, along with so many other things, have been great resources and tools. And sometimes, if there's financial loss, I've heard the police say it's really hard for us to recover the loss of funds. We've had issues with, sometimes there's this grandparent scheme that's out there, and we've had some individuals contact us to say they've been frauded out of thousands of dollars. What can they do? Well, there's a lot of administrative steps that people can take, but unfortunately, and I've heard directly from police officers that to recover that type of funding is almost inevitable. And the FBI, when they get involved, if they get involved, like they only really get involved in trying to obtain the money that was lost if it's like making headlines, billions and billions of dollars. Otherwise, they also kind of throw their hands up to say, I'm sorry that this has happened. This is what we can do. This is in the realm of possible, but then other things may not be. So calling our office if you have any issues or know people who have been frauded is one step in the right direction. And then, of course, contacting the Senior Medicare Patrol, which is a federal program through the Office of the Attorney General, is another way to be able to do that. And we can help you facilitate that as well. But thank you so much for the robust questions. I appreciate it.
Well, we'll be asking it again when we do the radio program. So I will be in touch as well, because those are all really important questions, not only for people in Arlington, but all over the country. So,
Yes.
but it looks like it's 10:59. So thank you so much, Michelle. As always, you've done a fabulous job of educating us about Medicare. And I put last year's program in the chat in case
Oh, thank
people
you.
were not able to listen to today's program. And so be sure and tune in next week, Coffee and Conversation. Our guest will be Rachel Gilbert. She's the Home Health Marketing Manager with Goodwin Living. And she'll talk about Goodwin House and, or Goodwin Living, I should say, and what kind of services are available through that, that program. So be sure and tune in. And until then, hopefully the sun will be coming out soon and we can all smile again. I think we're all tired of this rain. And Liz, by the way, thank you for putting that information about next week's program in the chat. So people will be able to check it out as well. So with that, hope you have a good day and a good week, and we'll see you next week, same time and same station.